Good morning and welcome to New South Wales Health's COVID-19 update for Monday the 7th of June 2021. New South Wales recorded no new locally acquired cases of COVID-19 in the 24 hours to 8 o'clock last night. 5 overseas acquired cases were recorded in the same period, bringing the total number of cases in New South Wales since the beginning of the pandemic to 5,411. 13,773 tests were reported to 8 o'clock last night, compared to the previous day's total of 17,524. In the week ending Sunday the 6th of June, New South Wales Health administered 80,729 vaccines. This is the highest number of vaccines administered by New South Wales Health in a week and includes 33,068 vaccines administered at the Sydney Olympic Park Vaccination Centre. The total number of vaccines administered in New South Wales is now 1,498,063, with 499,725 doses administered by New South Wales Health to 8 o'clock last night, and 998,338 administered by the GP network and other providers to 11:59 p.m. on Saturday the 5th of June 2021. New South Wales Health is treating 21 COVID-19 cases, none of whom is in intensive care. From 12 p.m. today, 7th of June, the stay-at-home requirements in New South Wales will no longer apply to Victorian residents living in the defined New South Wales-Victoria border region, as long as you have not been to a place in Victoria that is outside the border region in the previous 14 days, and you do not travel anywhere in New South Wales other than the border region. The border communities are defined by the map which was used for the previous border bubble arrangements. New South Wales Health was notified yesterday, Sunday evening, that fragments of the virus that causes COVID-19 have been detected in the Castle Hill sewage network. This catchment includes about 8,400 people and takes sewage from the following suburbs: Glenhaven, Dural, Kenthurst, Kellyville, Castle Hill. People who are recently recovered from COVID-19 can continue to shed virus fragments into the sewage system for several weeks even after they are no longer infectious. Nonetheless, New South Wales Health is asking everyone in these areas to be especially vigilant in monitoring for symptoms, and if they appear, to get tested and isolate immediately until a negative result is received. New South Wales Health continues to ask anyone who lives in Gundagai, Goulburn, Jervis Bay, Huskisson, Hyams Beach or Vincentia, or has visited these areas since the 19th of May, to be especially vigilant for symptoms after 4 travellers who later tested positive for COVID-19 spent time there. New South Wales Health would like to thank these communities for their efforts in coming forward for testing and reminds people to check the New South Wales Health site regularly, as health advice for venues may be updated. Ongoing investigations by New South Wales Health into the movements of the cases has so far identified 226 people as close contacts. None have tested positive to date, and the contacts who attended venues of concern within the past 14 days are continuing to self-isolate. We urge everyone in the state to continue to take practical measures to stay COVID safe, including practicing good hand hygiene and always using QR codes to check into and out of venues. We recommend wearing a mask in any situation where physical distancing is not possible, such as on public transport. If you have even the mildest of cold-like symptoms, please come forward for testing immediately and isolate until you get a negative result. There are more than 300 COVID testing locations across New South Wales. To find your nearest clinic, visit our website or contact your GP. Thanks very much.